Okay guys, Revo PT back with another video. Today we want to talk about durability in athletics. We've had a lot of questions coming in about what do we do with our athletes to keep them injury free. And there's not some magic bullet or some crazy technique that we look at. Everything is just about foundation work. So for runners, cyclists, skiers, anyone who's out there being active in life, the first thing we want to look at is just, can you have a stable platform specifically on one leg for those activities? Obviously, we're looking at lots of different factors, but today let's just talk about single limb stability. So we're going to look at just a little screen that a lot of people use, just a simple step down. So let's take a look. Okay guys, so here is a step down being performed. We've got our camera system locked onto these little LED markers. As we start this movement, we want to see ideally a lot of right angles. We like to see vertical trunk position, level belt, and ideally a straight line through femur and tibia. As we move into this single leg squat or just a step down, a lot of faults can be revealed. So if we move through this nice and slow, and Brian's doing a great example of showing some faults that we like to correct. We see his right hip starting to drop. We call that a pelvic drop. We see knee collapsing inward, like so. Major problem. We see this go up over, say, 10 degrees a couple times, I think. Maybe not on that rep. 13 degrees of knee valgus. 15 degrees of pelvic drop. Most of these things are caused from what we would call quad dominance. We see excessive quad use, excessive calf use. This is a huge risk factor for anterior knee pain, Achilles pain, plantar fascia pain, IT band issues, pain at the anterior hip, a whole host of lower extremity issues that most athletes face. So this is something that we want to really correct. Perfect world, we're going to see all of these measures less than 5 degrees. But we like to give people some variance on either side of 0. Regardless, this is a really common movement pattern that we see. So let's take a look at the other plane to kind of gather a couple data points. So here's Brian doing the same step down. Let's go to the faulty version first, if you will. So this would be categorized as the quad dominant movement here. Vertical trunk position, anterior knee is tracking very far anteriorly. Ooh, 34 degrees of weight-bearing ankle dorsiflexion. That's nasty aggressive, really tight. Brian was saying this was hurting his Achilles. We've got a massive shear force on the front of the anterior knee. Femur is basically trying to slide off the front of the tibia in this position. Patella is stopping that, which is not designed to do. So we're thinking here, this is all quad, no butt. If we go back to that other plane of motion, we know that the glute is going to control all the rotation and the pelvic drop that we saw in the other plane. So again, this is that classic quad dominance. Here is your more hip strategy, which is ideal. Hard hip hinge right off the bat, anterior trunk lean, tibia is staying fairly vertical, knee is posterior to the toe. Perfect. It's going to offload the knee. That requires less activation at the calf and uses much more glute activation, which is going to control all those rotary issues that we saw in the other frame. If you are running and you're going through a series of single limb stances over and over and over, you may not necessarily be seeing values to this extent, but due to the demand of doing 1 million repetitions, we can see huge issues result from small, tiny little faults. So the big question here becomes, is this a strength issue or is this a motor control issue? And we see plenty of folks who have really crazy deadlift numbers come in here and show quad dominance, not able to activate their glute max the way that we like. So we come at this from a motor control perspective. We're thinking similar to shooting free throws in basketball. You shoot 10,000 free throws, you've got that pattern hardwired. A lot of times these movements are hardwired, so it takes a lot of movement patterning and control work, not just strength work, to correct these. Overall, these foundational movements are part of being durable. Brian said this earlier, mobility plus stability equals durability. We don't just look at the movement, we look at everything else. We want to see mobility head to toe, full range of motion, instant access at all your joints. Then I'm going to give you muscle activation and active stability control via motor control training, and that's going to make a durable athlete.